Imagine this. A loved one, a parent, sibling, or friend experiences a sudden medical emergency. Their life depends on immediate care, but they hesitate, unable to pay for the ambulance, the hospital visit, or even basic medication. This is not a scene from a movie, it is a daily reality for millions of Americans. People are forced to choose between their health and financial ruin, a choice no one should have to make. Today, I'm here to argue that universal health care is not only a moral necessity, but a practical solution to the injustices of the U.S. healthcare system. A healthier future is possible, but only if we make healthcare a right, not a privilege. Everyone in this room has likely been affected by healthcare challenges, whether it's struggling with medical bills, delayed treatment, or watching someone close to you suffer because they couldn't afford care. This is not just political or economic issue, it's deeply personal and one that affects all of us. As someone who has researched this topic extensively and witnessed the flaws in our healthcare system, I'm deeply committed to advocating for change. This is not just theoretical, it's real, it's urgent, and it demands our attention. First, I'll outline the issues plaguing our current U.S. healthcare system, then I'll discuss the benefits of universal healthcare and how it can transform lives. Finally, I'll explore how universal healthcare can be successfully implemented in the U.S. Let's begin by examining the current problems in our current healthcare system. The current U.S. healthcare system is failing many Americans. Millions of Americans are uninsured or underinsured. According to the U.S. Census Bureau, 27.5 million people lacked health insurance in 2022. That's the equivalent of the entire population of Texas going without coverage. Even those with insurance often face high deductibles and out-of-pocket expenses, which can make life-saving treatments unaffordable. In rural areas, the lack of healthcare providers worsens the problem. Many people must drive hours just to see a doctor. Uninsured individuals delay seeking care, turning treatable conditions into life-threatening emergencies. For example, a simple infection could lead to sepsis simply because someone couldn't afford a trip to the clinic. The lack of affordable healthcare leads to preventable deaths. A study by the American Journal of Public Health found that 45,000 deaths annually are linked to a lack of health insurance. That's the size of a small city wiped out every year. Chronic conditions like diabetes and hypertension often go untreated, leading to worsened complications such as amputees or strokes. The U.S. has one of the highest maternity rates and fatalities in the countries that we have the resources for. The COVID-19 pandemic only made this even worse. Low-income and minority communities were hit the hardest, not because of the virus itself, but because of poor access to care. Healthcare costs contribute to financial ruin for many Americans. Medical bills are the leading cause of bankruptcy in the U.S., with over 500,000 families declaring bankruptcy each year. Think about that, 500,000 families losing everything because someone got sick. Families forced to deal with medical debt often must choose between paying for healthcare or basic necessities like food and housing. This financial strain has ripples effects, worsening access to education, housing, and job opportunities. Preventive care, which could save lives and money, is often skipped due to high costs, leading to even greater expenses down the road. Now that we've explored the flaws in our system, let's discuss how universal healthcare could address these issues. Universal healthcare would address all these problems and benefit all Americans. Universal healthcare ensures equal access to medical services. Under a universal healthcare system, every citizen would have access to care regardless of their income. Preventative care would be prioritized, reducing the need for expensive emergency interventions. Countries like Canada and the UK have proven that universal healthcare is possible. They view healthcare as a human right, not a privilege. Marginalized communities, often hit hardest by inequalities in our current system, would see significant improvements in access to care and overall health outcomes. Mental health services would be expanded, ensuring psychological well-being. Vulnerable populations like children and the elderly would no longer face barriers to essential care, ensuring a healthier future for all generations. Universal healthcare reduces overall healthcare costs. Administrative costs in the U.S. healthcare system are almost 3 times higher than in countries with universal systems. Streamlining these costs would save billions of dollars. Early detection of diseases and preventative care under a universal system will lead to significant long-term savings. For instance, catching cancer is much cheaper than treating it later. Universal systems offer bulk purchasing, drastically reducing costs. Businesses would save money by no longer needing to provide health insurance to employees. A healthier population means a more productive workforce, boosting the economy as a whole. Universal healthcare improves public health outcomes. Countries with universal systems, such as the UK, have a higher life expectancy and lower infant mortality rates than the US. Universal healthcare improves immunization rates and early detection of illnesses, creating healthier communities. During public health crises such as pandemics, universal systems ensure equitable distribution of resources and treatment. Improved health outcomes benefit schools, workplaces, and communities as a whole. Long-term care for chronic conditions is consistent and reliable under a universal system, improving quality for millions of lives. Now let's discuss how universal healthcare can become a reality. Implementing universal healthcare in the United States is possible. Funding can come from reallocating current healthcare expenditures. The U.S. already spends more per capita on healthcare than any other nation, yet millions remain uninsured. Redirecting funds from our current fragmented system to a single-payer system would create a more efficient and equitable system. Modest tax increases would be offset by the elimination of premiums, deductibles, and other out-of-pocket costs. Economic studies show that universal healthcare would reduce national spending on healthcare over time. Public support for universal healthcare is growing. A 2023 Gallup poll found that 65% of Americans support a government-run healthcare system. The majority of people want change. Policymakers can harness their growing momentum to pass comprehensive reforms. Grassroots movements and advocacy groups are raising awareness and applying pressure on legislators to act. Younger generations overwhelmingly support universal healthcare, ensuring sustained advocacy for change in the future. Gradual implementation can make the transition smoother. Expanding Medicare to cover for all age groups provides a scalable and proven framework for universal healthcare. Gradual changes allow time to address challenges and refine funding mechanisms. Successful state-level pilot programs such as Vermont's healthcare reforms provide valuable insights for national implementation. Advances in technology can streamline the transition, making the system more efficient. Public education campaigns would help citizens understand the benefits of universal healthcare and dispel misinformation. As we wrap up, let's revisit why this issue matters so deeply. In conclusion, the case for universal healthcare is clear and urgent. The current U.S. healthcare system is broken, leaving millions behind. Universal healthcare offers a path forward by ensuring equal access, reducing costs, and improving health outcomes. It is not just the right thing to do, it's the smart thing to do. The time for change is now. Advocate for healthcare reform, talk to your friends and family, support candidates who prioritize healthcare, and push for a system that values people over profits. Together, we can build a healthier, fair, and brighter future for all Americans.